Well, I am here today with Amy Goddard, who, how to describe you, Amy? You are one, a very good friend of mine, which is
Oh.
probably my favorite role that you play in my life, but also an incredibly talented physical therapist, somebody that I've had the pleasure of working with both as a patient provider, but also professionally in multiple aspects. And so when I thought of direct primary care, you were one of the first people that I said, oh, I've got to reach out to Amy and have her share her multifaceted story. So, first, just thanks for being here, Amy.
Well, thank you for having me.
The 30-second version of who Amy is.
Oh gosh. Um, well, I think first and foremost, I'm a doctor of physical therapy. And I love being a clinician. I've practiced for 30 years now.
Wow.
And I would say that that's kind of my first love. And then I would always forget to say, "Oh yeah, I'm a small business owner too," because that was kind of I had to learn how to be a business owner, and um, and so yeah, so small business owner. I owned a physical therapy clinic in Dallas in Capel for 22 years, and then sold that in 2023, and then had the opportunity to move back to Webb City, Missouri, near Joplin, and restart Go Sports Therapy as a cash-based business, working out of a fitness facility called Millennium Family Fitness in Joplin.
So let's kind of start at the beginning. What made you think about DPC for yourself over traditional primary care?
Well, so as I was thinking about that question, I was thinking about it. For me, it starts all the way back to 1991 when I was an employee at the Brookings Institution. One of our scholars by
Wow.
the name of Henry Aaron published a book called Serious and Unstable Condition Financing America's Healthcare. And I remember, the kind of the gist of that book is, the way healthcare is being done in this country right now is not sustainable. And that was back in 1991. So I think those
Wow.
were the kind of the first seeds that were planted for me about our healthcare system, and how it, needed to be different. And then when I opened my clinic in 2000, I I knew what it cost every time a patient walked through my front door,
Mm.
and um, I vowed never to sign a contract where I would lose money every time a patient walked through the front door. So I never wanted to play that volume game, and so from the very beginning, I just said no to United Healthcare, Aetna, and then dropped Cigna pretty quickly.
Mm.
Um, and so so, and then in around 2014, I began working with a business consultant, and named Bob Weersma, and he recommended a book by John Torino. It's called The Grassroots Healthcare Revolution, and how companies across America are dramatically cutting their healthcare costs while improving care.
Mm.
And in that, there were, statistics: one-third of medical spend is waste due to unnecessarily or duplicative services, or
Mm.
CYA, kinds
Right.
of unnecessary imaging and things like that. Three-fourths of medical spend is due to preventable lifestyle related diseases.
Ouch.
um, and so in that book, he started to talk about consumer driven plans and helping employers go self insured to try
Mm.
to control their costs. And, basically, he said that the healthcare costs were making employers in the United States non competitive in the world market.
Yeah.
And he promoted on-site healthcare and just trying to think of a different way to do healthcare and help employers rein in costs. And then I was introduced to Health Rosetta and started following David Chase. And he was really the first one that planted the seed that healthcare actually is predatory, and that healthcare stole the American dream is kind of his that the cost of healthcare, and you know, what started happening, what started shifting was, employers started to shift more and more of the cost, you know, to their employees. And so, then I read a book called The Price We Pay by,
Mhm.
What Broke American Healthcare and How to Fix It by Dr. Marty McCary. And
Mhm.
he, you know, started to talk about how how we can be better healthcare consumers and begin to seek out and pay cash for healthcare and outside of the insurance system. And then it was about that time that I met Brett Brummett, and he's the one that introduced me to the Free Market Medical Association.
Mm.
And so I went to one of the Free Market Medical Association annual conferences in Dallas and just started meeting these people and hanging out in these circles. And that's where I first heard, I think, about the direct primary care model.
Mm.
And two things were happening at the same time. So I was an employer. I had 10 employees. There were like 5 of us that were full-time, and that I wanted to provide healthcare, you know, insurance for. And, you know, it was, you know, 20 years later, and I'm 20 years older, and my personal health insurance premiums were close to about $1,000 a month.
My
And
gosh, which
and
is
I
wild as healthy as you are.
well, and I had 3 other employees that were about my age, and it was the same situation, right?
Ouch.
And then I had a 60, that was with a high deductible health plan,
Mm.
$6,700 deductible. So what was happening for me is I'd go to my dermatologist and they'd say, well, we can do this and bill your insurance. And we're out of network and you're never going to meet your deductible. And it's going to cost you $350 if we bill your insurance, but you can pay $150 cash. And so I always would just pay the cash. So I had this very expensive healthcare insurance that I couldn't afford to use.
Yeah.
And so, um, so, so that was happening. And then the other thing that was happening is as I was reading these books, that I just talked about, I was
Mhm.
sharing that information at my staff meetings. So by the time I
Ooh.
met Brett and the Free Market Medical Association and Direct Primary Care, my employees had been hearing these stories for, you know, at least probably 6 or 7 or 8 years.
Oh, wow.
And so I had started to plant the seed with my employees. So when it came time to, so after I went to the Free Market Medical Association annual conference in Dallas, I Googled direct primary care,
Mhm.
and I found this direct primary care doctor in Grapevine, and it was about a 4:30 on a Friday, and I called, and Dr. Farley answered the phone.
Oh my goodness.
And I was surprised that the doctor answered the phone, and she was actually out of the off. She was on vacation with her family, I think in Michigan. And I said, "Oh, I'm sorry to bother you. You know, we can talk at different times." She goes, "No, I'll talk to you." We ended up talking on the phone for about an hour,
Whoa.
just about direct primary care. And then I said, "Well, I would love to. I'm thinking about switching to that model, and I'd love to have you come and meet our team." So she came over to Capel and met our team. We had lunch,
Oh,
and I
wow.
introduced her to the team. Um and so then the other part that kind of the part that gave me the courage, I think, to switch to the direct primary care model was the other part is the Sedera model.
Mm,
And
mhm.
I was introduced to Tony Dale, I think at a Free Market Medical Association event, and he's the founder of Sedera. And isn't he? Yeah, founder of Sedera. And I read his book, The Cure for Healthcare, and Sedera offers, it's a cost sharing community, and they're based out of Austin right there. And so when you combine the direct primary care plus the Sedera, now you have coverage for your employees that, you know, will cover them for direct primary care and catastrophic. And and then plus, if you have a direct primary care provider, you get like a 17% discount with Sedera.
Mm.
So when I made the switch, I had to, it was a lot of work. I had to sit down one-on-one with my employees and show them, this is what you're going to get. And, they had to be on board with it too. But I think I talked about it long enough that they were, ready to be on board. And so when I went on board with Dr. Farley and Sedera, I was able to cover 100% of my employees' costs. So I covered their direct primary care subscription, monthly subscription, and their Sedera premium, or whatever you want to call it. I covered 100% of that.
Oh, wow.
They got better care, and I saved $1,000 a month as a small employer.
Oh, wow. That's significant.
It's significant, and they got better care. So
Yeah.
yeah,
That seems like a no-brainer.
yeah.
Yeah. So talk about, like you said, better care. Describe what that better care is. And like tangibly, what did that mean for you? What did it mean for your team?
Yeah, and I think the biggest difference I noticed is with the DPC model is the relationship with my doctor. So I would, access to your doctor.
Mm.
Um, Gone are the days of calling an office, um, and having to leave a message that gets passed to a nurse practitioner, then that you never know if it ever gets to where it's supposed to go. You know what I mean?
Right.
Um,
Such a beating.
it's such a beating. And then it's always, several days before you ever hear anything. And so I mean, you could call the office, and you could sometimes Dr. Farley even would answer the phone, and so you can get in the same day usually.
Mhm.
And I remember the first time my initial visit with Dr. Farley, she spent 2 hours with me
Oh,
and
wow.
took my whole medical history. And I think I got like a skincare check and a pap
Mhm.
smear and an annual exam and everything all in one, and just felt cared for. And so yeah, I would say it's the relationship with my doctor.
Mhm.
You know, a lot of doctors that function within the insurance system, the healthcare system, um, typical primary care doctors have anywhere from 2,500 to 5,000 patients in their panel.
Yeah.
And Dr. Farley wanted to cap hers at 500.
Mhm.
And so there's less lives that she's having to care for, and therefore she's more available and can give better care herself. And so yeah.
Yeah. Well, and how amazing for you. I mean, thinking about you not as the owner, but as a, productive member of the practice, that what you just described, that would have probably been what, 3 mornings out of clinic to go get all those things done, to see
Oh
the
yeah.
OB-GYN and the dermatologist, and then add that up with all of your other physical therapists. And yeah, I mean, the membership is paid for itself when you take one PT and don't have them out of clinic for half a morning.
Yes. Yep. Good point. Yeah.
Yeah.
Great point. Yeah.
Yeah. What about, I know that you're really intentional about culture and how you treat the humans and support people on the team. What would you say, how did DPC work with that? How did it support kind of the culture of Go Sports Therapy and what you were trying to do there?
Well, I think, I think at the free one of the Free Market Medical Association annual events, they talked about the cost of healthcare, and they likened it to paying for a wedding every year.
Oof.
So, it's crazy. And it's so the, and so many people are beholden to their healthcare benefits.
Mm,
So they're taking jobs or staying in jobs, um, because of these healthcare benefits that are a lot of times really not, it's not great coverage anyway.
yeah,
And so I've always thought I never want to be beholden to, a job just because of health benefits, health insurance benefits. Um, and so, being able to, so that's one thing I think that the direct primary care plus Sedera model does is it opens up a whole new world for small, self-insured employers like myself. And like now, like I was able to move to Joplin and open up a clinic, a cash-based clinic, and I'm covered. I have coverage. I have a direct primary care doctor here in Joplin and plus Sedera. And I was able to do that and still have coverage.
yeah,
So it just opens up a whole new door. And I the other part to that is I felt like my employees were actually getting better care. Or they were having the same experiences I was having. I've always, I heard about concierge medicine a long time ago, but my problem with concierge medicine was at the time was, okay, that's great if you're an executive, you can pay thousands of dollars, to have this
right.
personal doctor. The direct primary care model opens up this kind of care to the masses. And that was always important to me. It should be affordable for everyone.
Yeah,
Um, and it's crazy to me now thinking about how long I've done that, and have been in the direct primary care model. And I have conversations with people and I tell them, and they're like, what?
yeah.
They still
Like
can't
it's
believe.
magic or that it's crazy expensive.
Yeah, they just can't believe that that's so one of my really good friends from Coppell, she lives in Grapevine now, and her mom, her elderly mother's living with them. And she was getting so frustrated with, her mom would fall or have a spell or something and would have to go to the emergency room. And they would just sit there and sit there and sit there. And then, and then it got to the point where, her mom was saying, I'm not going to the emergency room, anymore. And so then she would try to get into her doctor and never could, speak to anyone, couldn't get in when she needed to get in. And I said, why don't you call Dr. Farley and just see if she would take your mom as a patient? So I gave her the number to the clinic and my friend called it and Dr. Farley answered.
Oh my goodness.
And my friend was like, oh, I'm so sorry. I thought I was calling the clinic. I didn't mean to call your cell phone. She goes, no, she goes, you called the clinic. So she was like shocked that Dr. Farley answered the phone. And then when her mom went, she took her mom there and Dr. Farley spent 2 hours with her. My friend called me crying. She was like,
Mm,
I didn't even know that this existed, this kind of care existed in the United States. And then she called me just a couple weeks ago and she goes, I have to thank you again for Dr. Farley. She's actually coming to the house to check on mom today. And
no way.
yeah. And so, it's just like it's the way healthcare is supposed to be,
Yeah.
you know.
Yeah. When you moved, did you even contemplate for a second going back to traditional primary care?
No.
Or like, are you DPC for life?
Oh, I'm DPC for life.
So, wrapping up, if you could say something to an individual or company that's considering making the switch to DPC, what would you tell them?
Just do it. The direct primary care model, um, is great for individuals. It's great for employers. and they'll get better care. It's going to cost you less as an employer. You're not beholden. You don't have to take a job or keep a job just for healthcare benefits. There's just so many advantages.
Well, Amy, thank you as always for your time and your passion. And we all have a very long reading list now, which happens every time I talk to you. You're one of the most well-read people I know. So thank you for all of that.
Well, thank you. Thank you for your time.